Welcome. I am Terry Tropin, and today I'll be discussing ICD-10-CM coding for complications of care. Let me start with information about myself. I have a master's in healthcare administration, and I have an RHIA, CCSP, and I am an HEMA-approved ICD-10 trainer. I'm retired, but I used to teach at Montgomery College, Silver Spring, Tacoma Park, Maryland. I taught coding and I taught medical terminology. Now I am a teacher. I am an author of books, and these came from the study guides that I used to use for my teaching, because the guidelines are very confusing. So I developed study guides to help my students. I did one on evaluation and management coding, one on CM coding, one on PCS coding, and I also developed kind of a mini book that describes the changes each year for CM and PCS codings. And here's one on the 2024 books changes. These are available on Amazon and they're updated every year. So what are we going to talk about in this video? We're going to talk about how to find complications in the alphabetic index. We're going to talk about complications codes found in Chapter 19, and then specific sections for complications within each chapter of the body systems, chapters 1 through 18, and then in Chapter 20. Then the complications guidelines for specific body systems. Not every chapter is going to have specific guidelines, but many do. And have specific sections within the chapters for complications, but many do. Not every chapter has specific guidelines for complications, but many do. And then finally, I'm going to do some practice cases, because cases are always helpful so that you can kind of put together what we talked about into a specific case. So first of all, what is a complication? Well, complication is an unfavorable result of a disease, condition, or treatment. It occurs during the disease process or during or immediately after a procedure. For example, a complication of sepsis is kidney failure. A sequela is a symptom that remains after an illness or adverse reaction. It occurs after a disease process, but can start during disease process, but remains afterwards. For example, a sequela of a stroke is hemiparalysis. So, remember, it's very important to remember that the documentation needs to specifically state the condition is a complication of the procedure or surgery or condition in order to be coded as a complication. Just because a condition is present doesn't mean that it is a complication. It needs to be stated as a complication, and if it's not clear, you need to ask the provider, hey, is this a complication or not? So where do we find complications in the alphabetic index? In most cases, you can look up complications, and then you can find the subterm that lists the specific complication. Another way to find them is to look up the complication and then find terms such as postoperative, intraoperative, that will indicate that it is due to the procedure or the condition, and that will tell you that it is due to, that it is a complication. Pain, postoperative, painful, joint replacement, fever, postoperative, obstruction, postoperative. That tells you that it is due to the procedure. Okay, so here are some general guidelines about coding complications, and you see down here, this is where you will find these in the guidelines. So when in doubt, query the physician. Ask the physician. Do not assume a condition is a complication. So some complications, but not all, require an external cause code, Y62 to Y84, and we'll talk about that later on. When an admission is for treatment of a complication resulting from medical care, list the complication code first. First of all, you say, this is a complication, and then you say, and this is what the actual specific complication is. If the complication is classified to a category T80 and the code lacks necessary specificity to describe the complication, use an additional code for the specific complication. Most of the T codes are kind of general, and you need to say, well, what is the specific complication? Sometimes you're going to use both a code from the body system and a code from Chapter 19. Use both. You want to make it as specific as possible. So here are some more general guidelines. Chapter 19, complications. We're going to talk about Chapter 19 and then complication codes, and then we're going to talk about codes for each specific chapter, the other chapters. Chapter 19 is injury, poisoning, and certain other consequences of external causes. This chapter includes codes for complications that affect multiple sites or body systems, including complications following infusion, transfusion, and therapeutic injections, complications of procedures, NEC, not elsewhere classified, of cardiac and vascular prosthetic devices, implants, and grafts, of genitourinary prosthetic devices, implants, and grafts, internal orthopedic prosthetic devices, implants, and grafts, other internal prosthetic devices, implants, and grafts, transplanted organs, peculiar to reattachment and amputation, and other complications not elsewhere classified. So this gives you general complications, and then there's more specific codes within these categories, and often you need something from another category to be even more specific. So the complication codes in Chapter 19 are T80 to T88. Now, all of these codes have these notes. Use additional code for adverse effect if applicable to identified drug. If there's a drug involved that's causing the complication, T36 to T50 with additional fifth or sixth character 5. Use additional code to identify the specific condition resulting from the complication, and then use additional code to identify devices involved and details of the circumstances. So all of these in T80 to T88 have these notes. So for T80 to T85 and T88 includes these boxes for seventh digits, but T86 and T87 do not. So these T80, T85, and T88 include seventh digit for initial encounter, subsequent encounter, and sequela. Okay. But T86 and T87 do not. So T82 to T85 include complications for mechanical complications. That includes devices. So these mechanical complications, and there are subcategories within these for breakdown of the device, displacement of the device, it's kind of moved, leakage of the device, obstruction, perforation of the device, implant, or graft. Also infection, inflammatory reaction to the device. So the body is having a reaction to the presence of the device, and other complications. Now these are for cardiac, vascular, genitourinary, orthopedic, and other prostheses, implants, and grafts. Now, category T86 is complications of transplanted organs and tissues. Use additional code to identify other transplant complications such as, and it gives specific, you're going to use T86 and use additional codes. So T86 is first, and then you're going to use graft-host disease, malignancy associated with organ transplant. So they transplant an organ, and then it turns out to malignancy. Boy, that's really bad luck. Or post-transplant lymphoproliferative disorders. So this is specific transplants, bone marrow transplant, kidney transplant, heart lung transplant, liver transplant, stem transplant, and other. So complication of transplanted organs and tissues used for both complication and rejection of transplanted organs. Used for both complication and rejection. Use these codes if the complication affects the function of the transplanted organ. Only if it affects the function of the transplanted organ. Use two codes, a code from T86 and then another code for specific complications. So again, T86 is first and then another code for the specific complication. Do not use T86 if it doesn't affect the function of transplanted organs. And remember, there are different guidelines for kidney transplants. And we're going to talk about these when we talk about chapter 14, genitourinary conditions. Okay, so also in chapter 19, T87 category is complications peculiar to reattachment and amputation. It's interesting to me that they use the word peculiar to, which means concerning, but I don't know, I think it's weird that they use the word peculiar, but anyway, they do, so there you go. It have different categories, different codes for upper extremity, lower extremity, other reattached body part. And then they have T87.3 to 0.5 and T87.8 for the stump. So it's not reattached, it's just the stump. So 0.0, 0.1, 0.2 is reattached, and the other ones are for when it is not. Okay, so that's the codes that are in chapter 19. So let's talk about the ones that are in other specific chapter. Some, but not all, chapters have specific separate categories for post-procedural and interprocedural complications. And they have separate categories for that. They're all listed all together, but not all chapters have that. So here are the ones that do. Chapter 4, endocrine system. The complication codes are in E89. Chapter 6, nervous system. The complication codes are G97. Chapter 7, eye and adnexa, H59. Chapter 9, circulatory, I97. Chapter 9, respiratory system, J95. Chapter 11, digestive system, K91. Chapter 12, skin and subcutaneous tissue, L76. Chapter 13, muscular system, M96. Chapter 14, genitourinary system, N99. Most of these have a section for intraoperative and post-procedural complications of specific body systems. List these codes first with an additional code for more specificity as needed. Codes are also included to describe when a procedure is being performed on one body system, but the complication involves a different body system. For example, I97.52, accidental puncture or laceration of a circulatory system or structure during other procedure, meaning outside a circulatory system. For example, a procedure could be performed on a lung, which is the respiratory system, and the heart could be accidentally punctured, which is a totally different body system. So, performed in the respiratory system, but the complication is in another body system. So, those are the general systems. Now, we're going to talk about specific guidelines for specific complications. Not all chapters have that, but that's what I'm going to talk about next. So let's start with chapter 1, sepsis. Lots of guidelines about sepsis. There are very specific guidelines for this. So the guidelines for this say sepsis due to post-procedural wound, surgical site infection. It must be documented as an infection due to the procedure. The guidelines say code first T81 081.41 to T81.43, or 086.00, 086.03 if it's obstetric, to identify the site of the infection, the wound. Then code for sepsis following a procedure, T81.44, or 086.04 if it's obstetric. Then code for infectious agent, what the infection is, the virus or bacteria. Then code for severe sepsis, if appropriate, R95.2. Then code for any acute organ dysfunction, if appropriate. So very specific guidelines for that. There are also specific guidelines for post-procedural infection and septic shock. So code first T81.41, T81.43, or 086.00, 86.03 if it's obstetric, to identify the site. Then code for sepsis following procedure, T81.44 or T86.04. So far we're pretty much in line with what we had before. Then the infectious agent, then organ dysfunction, then T81.12 with another digit, post-procedural septic shock. The difference is that T81.12, and it says do not code R65.21 severe sepsis with septic shock, because you've already got that with this code, and doing the R65.21 would be redundant, repetitive, and we don't want to code the same information twice, right? That would be silly, and that would take up space that you may need for something else. Okay, so also in Chapter 1, complications for infections following infusion, transfusion, therapeutic injection, or immunization, assuming that it's documented as a complication. And we're still talking about sepsis. Sepsis is a really big deal, and it's confusing. I have a whole, the first video I did on my YouTube channel was on sepsis, and it's very popular. So we have a whole video on sepsis if you want to check that out. For infections following infusion, transfusion, therapeutic injection, or immunization as a complication, list first a code from subcategory T80.2, infections following infusion, transfusion, therapeutic injection, or 288.0 following immunization, then a specific infection, then R65.2 if appropriate, then any acute organ dysfunction if appropriate. So lots and lots and lots of stuff on sepsis. So that's all we got, the lot for Chapter 1. So let's look at Chapter 2. Also lots and lots on Chapter 2. Neoplasm, lots of guidelines. So treatment of a complication resulting from a surgical procedure, list the complication as the principal diagnosis, assuming that's the focus of what's going on, of what the encounter is for. So malignant neoplasm associated with transplanted organs. So transplant took place, the transplanted organ is found to be cancerous. Code is a complication of the transplant. Assign first a code from category T86, then code for the malignancy, C80.2, malignant neoplasm associated with transplanted organ, then the specific malignancy. Okay, so this is so confusing that I just did it in charts. If you send me an email, terry.tropin@gmail.com, I will send you the slides, and you can have these nice little charts that all listed out. So first look at anemia as a complication of treatment. So they're very, very specific. It all depends on why the patient is being seen. If the patient is being seen for treatment of anemia due to the malignancy, and only the anemia is being treated, code first the malignancy code, and then anemia and neoplastic disease, D63.0. If the treatment of anemia due to the malignancy and the malignancy is also being treated, Same thing, malignancy code first, and then anemia and neoplastic disease. If treatment of anemia is due to the chemotherapy, and only anemia is being treated, you have it a little bit different. Anemia due to chemotherapy, D64.81, then the malignancy code, and then adverse effect of the drug, T45.1X5. Treatment of anemia due to immunotherapy, only anemia is being treated. You have other specified anemia, and then malignancy code, and then adverse effect of drug. Treatment of anemia due to radiotherapy, only anemia is being treated. Other specified anemia, and the malignancy code, and then external cause code. Okay. Treatment of anemia due to both therapy and the malignancy. Malignancy code is first. So a lot of really specific sequencing rules, okay? Malignancy code, anemia, neoplastic disease, anemia due to anaplastic chemotherapy, and adverse effect of drug. So if the treatment includes chemotherapy, immunotherapy, or radiotherapy, patient develops anemia during the encounter. You do the therapy code, the Z51 code, and then anemia due to chemotherapy, D64.81, and then the malignancy. And that's just anemia. So what about dehydration? Treatment of dehydration due to malignancy, only dehydration is treated. Dehydration, E86.0, and then the malignancy. Treatment of dehydration due to malignancy, malignancy also treated. Malignancy code is first, and then dehydration. Treatment of dehydration due to chemotherapy, only dehydration is treated. Dehydration first, then malignancy, the adverse effect of drug. Treatment of dehydration due to both chemotherapy and the malignancy, malignancy first, then dehydration, then adverse effect of drug. Treatment includes chemotherapy, immunotherapy, or radiotherapy. Patient develops dehydration during encounter. Therapy code, then dehydration, then malignancy. So very, very specific sequencing. You know how important sequencing is to ICD-10 coding. Okay, the fracture due to malignancy. Treatment for fracture due to malignancy. Only the fracture is treated. Pathological fracture, M84.5, and then malignancy code. Treatment of both malignancy and the fracture, malignancy and pathological fracture code. Pain due to malignancy. This is severe pain. It's not just normal pain due to surgery for the malignancy. This is real pain. Pain related to malignancy, only pain control or management is provided. Malignancy-related pain, G89.3, and then malignancy code. Treatment of both malignancy and malignancy-related pain, malignancy first, and then malignancy-related pain. Okay, other complications, malignancy of transplanted organ. Complication, T86 code first, malignancy of transplanted organ, malignancy for specific site. Complications of surgical treatment of malignancy. Complication code, then malignancy code, or history of malignancy code. Pleural effusion due to malignancy. Malignancy, then malignant pleural effusion, J91.0. Malignant ascites. Malignancy, then malignant ascites, R18.0. Treatment including chemotherapy, immunotherapy, or external beam radiotherapy. Patient develops complication during this encounter. Therapy code, complication code, malignancy code. Insertion or implantation of radioactive elements such as brachytherapy, malignancy, and then complication. So very, very specific. That's why I did these charts, because it's the only way to do it. Only way to keep all this stuff straight. Okay, so hope that's enough for you. That finishes up chapter 3. Moving on to chapter 4, endocrine system. So this is the guidelines are basically for insulin pump malfunction for diabetic patients. So you can have underdosing or you can have underdosing. So the pump breaks and give you too much or too little. So the guidelines state if it's underdosing, assign a code from subcategory T85.614 as the principal diagnosis. then T38.3x6, then code for the type of diabetes and associated complications due to underdosing. If it's an overdosing because the pump failed, assign a code from T85.614 as principal diagnosis, then T38.3x1, then type of diabetes, any associated complications. So that's pretty straightforward. Okay, so that's all we have for that chapter. So let's move on to chapter 6. So this is pain, disease of nervous system. So the guidelines related to post-operative pain. So this is not just, and we all have, I don't know if you've had surgery, I've had surgery, it hurts. This is not just, it hurts, this is pain. So post-operative pain associated with specific post-operative complication. So let's first decode from chapter 19, such as pain from device, implant, graft, T82.84, T83.84, T84.84, T85.84. Then a code from category G89, acute or chronic pain, G89.18, G89.28. Okay. Because pain from a device, the T82 codes don't give you all the information. The G89 code gives more information indicating it's acute or chronic. So that gives you more information. Okay, so let's jump ahead to chapter 10, diseases of the respiratory system. So these guidelines are about ventilator-associated pneumonia, VAP. Code is based on the provider's documentation. If the documentation is unclear, query the provider. Now, the coding depends on whether the patient had VAP at the time of admission or developed VAP after admission. This is important because if they develop VAP after admission, it might indicate less than good care. So that's what the provider, the insurer wants to know. Was it because of a lapse in care? Okay, so here are the guidelines. If VAP was present on admission, code J95.851 VAP if documented. Then code for the organism, and we want to use those B codes, B95, B97, that's infection and condition elsewhere. Do not use an additional code to identify the type of pneumonia. If VAP developed after admission, code first the type of pneumonia the patient had when they were admitted, and then the VAP, and then the organism, B95, B97. So that tells the insurer that they had VAP when they were admitted, or they had developed VAP afterwards. Okay, so that's all the guidelines for chapter 10. For chapter 13, diseases of musculoskeletal system and connective tissue, what we have here are complications, malunion and non-union. Malunion, the fracture fragments unite, but they're not properly aligned. Non-union, the bony healing is not achieved at the fracture site. So this is indicated by the 7th digits. Delayed healing, non-union, malunion. So that's how you indicate. And they take the same original fracture code that you've been using all along for this patient, and using a G, a K, or a P to indicate the complication. So this is actually fairly unusually straightforward. So, chapter 14, diseases of the genitourinary system. So this is about the kidney transplant. Remember that I said the guidelines for kidney transplants are different than those from other transplants. And these guidelines are listed in chapter 14. Patients who have undergone kidney transplant may still have some form of chronic kidney disease because the kidney transplant may not fully restore kidney function. Function may be better, but it's not 100%. Often it's not 100%. Therefore, the presence of CKD alone does not constitute a transplant complication such as failure or rejection or other transplant complication. If the documentation is unclear as to whether the patient has a complication of the transplant, query the provider. If it is not a complication, list a code from category N18, chronic kidney transplant, chronic kidney disease, and Z94.0, kidney transplant status, assuming there's no other complication documented. So you're going to say, patient had a kidney transplant and they still have this stage of kidney disease. So assuming the condition is indeed a complication, code first from chapter 19, T86.1, complication of a kidney transplant. Is it a rejection? Is it a failure? Is it an infection? Is it other? Is it unspecified? Hopefully it's not unspecified. Hopefully you have enough information to say what kind of complication it is. Then you're also going to code N18 for the current stage of chronic kidney disease. And then you're going to code Z94.0, kidney transplant. And you also use additional code to identify other transplant complication. Graft versus host, it should be host disease, malignant associated with organ transplant, and post-transplant lymphoproliferative disorders. So that's all we have for that chapter. This chapter, we're back to sepsis. This is chapter 15, abortion, pregnancy, childbirth, and puerperium. Sepsis complicating abortion, pregnancy, childbirth, puerperium. Okay, so list first obstetric codes. Remember, obstetric codes trump everything. So you have sepsis following incomplete spontaneous abortion, sepsis following complete or unspecified spontaneous abortion, sepsis following induced termination, sepsis following failed attempted termination, sepsis following ectopic and molar pregnancy, puerperal sepsis, sepsis following obstetric procedure. So those are the codes where you might find sepsis. So first code the obstetric code, then code for infectious diseases, and we're using those B95, B97 code. Then code for severe sepsis, if appropriate, R95.2. Then code for acute organ dysfunction, if appropriate. Do not use a code from category A40 or A41 for puerperal sepsis. May use for other infections in pregnancy. Okay, so remember, this is just like what we talked about in chapter 1. Sepsis due to a post-procedural wound of the surgical site must be documented as infection due to procedure. Code first 086.00, 086.03 to identify the site of the wound. Then code for sepsis following procedure 086.04. Then infectious agent, the B95-97. Severe sepsis, if appropriate, R65.2. Then any acute organ dysfunction, if appropriate. Do not use code 085, puerperal sepsis, for a sepsis following obstetric procedure. Okay, so now we're going on to chapter 20. We already talked about chapter 19. We're on to chapter 20. External cause. Sometimes an external cause code is also required in addition to complication codes. Now, sometimes a complication of care codes have the external cause included in the code. For example, T81.530, perforation due to foreign body accidentally left in body following infusion or transfusion. That pretty much says it all. So we're not going to use an additional external cause code. So here are the categories within chapter 20. You have misadventure to patients during surgical and medical care, Y62, Y69. Medical devices associated with adverse incidents in diagnostic and therapeutic use, Y70, Y82. Surgical and other medical procedures as causes of abnormal reactions to the patient or of later complications without mention of misadventure at the time of the procedure, Y83, Y84. Now remember, these are in the external cause index. These are not in the regular alphabetic index. Now, a misadventure is a oops. the provider made a mistake. A medical device, the Y70, Y82, is something happened to the medical device. It broke down. In Y83, 84, the patient reacted abnormally to the medical procedure. And remember, it says without mention of misadventure. So it's not an oops on the part of the provider. The patient had an abnormal reaction. So let's look at each category more closely. Misadventure means an etiological condition due to treatment. So you can see this is somebody did something wrong. Y62, failure of sterile precautions. Y62, failure in dosage. Y64, contaminated medical or biological substances. Y65, other misadventures. Y66, not administration of surgical and medical care. Y69, unspecified. So those are all mistakes. So to find these codes, go to the external cause index and look up misadventures, failure, not administration, or you can simply look up wrong. So complications of medical devices, Y70, Y82. This is breakdown or malfunction of medical device. This can be during use, it can be after implantation, or after long, ongoing use. And they have specific categories for specific types of devices. This is not the provider's fault. You have anesthesiological devices, cardiovascular, otorhinolaryngological devices, gastroenterological, urology, general hospital personal use devices, neurological devices. Obstetric gynecological devices, ophthalmic devices, radiological devices, orthopedic. So it's very specific about the type of devices in here. Now each category in here, the medical devices, describe fourth digits of what the device is being used for. Is it diagnostic and monitoring? Is it therapeutic or rehabilitative? Is it prosthetic and other implants? Is it surgical instruments or materials, including sutures, or miscellaneous? So in the index, external cause index, look up incident adverse device. So categories 83 and 84, there are two categories: surgical operations and other surgical procedures, that's Y83, as cause of abnormal reaction of patient or later complication, not a misadventure at the time of procedures. Y84 is other medical procedures. So 83 is surgical procedures, 84 is other medical procedures. So Y83 is abnormal reactions or later complication of surgical operations procedures. Transplants, implants, anastomosis, bypass or graft, external stoma, other reconstructive amputation, removal of organ, other, and unspecified. 84 is catheterization, dialysis, radiological procedures, shock therapy, aspiration, insertion of sound, urinary catheterization, blood sampling, other, and unspecified. So codes in the external cause index for complications, codes are listed by the specific procedure that resulted in a complication. So complication of biopsy, implant, surgical operation, transfusion, transplant. So let's do some practice cases. So I'm going to read the practice, and then I'm going to pause for a minute. If you want to stop the recording and do this yourself, that will be fine. The patient received a hysterectomy 2 days ago. She is seen today because of severe abdominal pain around the surgical wound. The surgical wound is reopened. The physician found that a surgical instrument had been left in the body. The instrument was removed. the infection treated, and she was resutured. Uh-oh. Do you see a lawsuit coming for this one? I sure do. Okay, so we're going to list T81.500A, first encounter, G89.18, acute post-procedural pain, Y65.4, failure to introduce or remove other tube or instruments. Okay, the guidelines state first the T code from Chapter 19, then a code from G89 to indicate acute or chronic pain. We want to say this is acute pain. Note under T80, T88, use additional code to identify devices involved and details of circumstances. So that's why we're going to use the Y85.4. Okay? Okay. Bone marrow transplant with rejection syndrome, acute graft versus host disease. Okay, patient had kidney transplant last year. Now he presents with stage 2 chronic kidney failure. Okay, we're going to do N18.2, Z94.0. Didn't say anything that this was a complication. So in the index, find history, personal transplant. This refers you to transplant. So we're going to do N18.2, Z94.0, history of transplant. But first we're going to do chronic stage 2 kidney disease. We can't assume the CKD is a complication of the transplant. Okay, during a cardiac catheterization procedure, intraoperative, the physician accidentally, punctured the patient's heart. So we're going to do I97.51. In the index, find complication, accidental puncture, intraoperative puncture, or laceration, circulatory system, during the circulatory system procedure, which refers you to I97.51. If you look at the external cause index, look up misadventure puncture, you're referred to injury. So that's telling you that there's not going to be a Y code, an external cause code to go with this. So only I97.51. If you look at this code, that pretty much says it all. Complication, accidental puncture, intraoperative, circulatory system. That pretty much says it all, right? Okay, so here we are at the end of the video. If you have questions or comments, please let me know. If you want a copy of the slides with all those charts for the neoplasm complications, let me know. Just send me an email here, and I will be more than happy to send them to you. I have these books on Amazon on E&M coding, ICD-10-CM coding, ICD-10-PCS coding, and the 2024 changes. These will be updated for 2025 as soon as I get the information, which will be sometime this summer or in the fall. So go on Amazon books, type in my last name, and these books will come up. You can go on to Facebook, find me there, you can email me, and here are my books. Thank you so much for listening. I hope this was helpful. Thank you.